A very good morning. People who develop urinary tract infection are people who go through a misery of getting it recurrent urinary tract infection. That means once a urinary infection happens and we treat the urinary infection and have not found the cause, men can develop infection again and again. Women, because of their anatomy, are made such that they can develop urinary infection more frequently than men. Why? Only because the urinary passage which opens at the level of introitus, where a female urinary passage opening is surrounded by the vaginal opening and the rectal opening, which have got bacteria that contaminate the introitus, and therefore the demand for hygiene in women is higher than in men. It doesn't mean the men don't need any lesser hygiene than women, but just the anatomy created such as where the friendly neighborhoods of urinary passage, where there are no bacteria, are two organs, the vagina and the rectum. We actually have bacteria seated there, actually have microorganisms seated there. And there are no lock and key in the vagina and the rectum, which means that the bacteria could easily come out of their openings and could be in the neighborhood of a urinary opening, which is in close proximity to the anus and to the vagina. The bacteria which are there in these two passages are normal commensals, are normal flora, and they when would travel into the urinary passage for reasons well known to women at younger age group and in postmenopausal age group could get infected. But today let's talk about men and urinary tract infection. Women can develop urinary tract infection only because of an anatomy, only because of requirement for a sexual hygiene which is demanded out of the anatomy that is created, or because postmenopausal aspects and therefore the hormone effect is gone in that introital area and the bacteria can more easily go into the vagina, into the urethra, sorry, and cause infection. This infection happening in women presents with burning sensation, discomfort, painful urination, which we call as strangury, going to pass urine multiple times and probably having sometimes a febrile reaction or a feverish kind of an attitude where the bladder can actually let the bacteria go up into the kidneys called as pyelonephritis. That becomes a systemic disease and women then continue to suffer. More so in elderly, more so in people who have got psychotic reflux or more so who are immunosuppressed pregnancy and probably would have an ascending UTI which causes pyelonephritis, fever, chills, sadly, in very emergency state and hospitalization. So UTI cannot be taken lightly. Unfortunately, everybody treats a UTI, but we need to look into what does UTI mean. That means there is some gap somewhere which has not been fulfilled, and probably you can get an infection. So women develop recurrent UTI. I at Kokilaben Dhirubhai Ambani Hospital, Dr. Sanjay Pandey in the Department of Urology, continue to see women all 7 days a week, either with the mildest of the burning sensation, discomfort, frequency of urination, pain while passing urine, or pain when the bladder fills up. And thereafter, somebody could develop into an ascending pyelonephritis or a severe infection. And sadly, women develop recurrent infections, and we probably need to bridge the gap. We need to identify the causes. I need to probably seal that completely. So aspects have to be identified in each woman who goes through recurrent UTI needs to be seen and probably needed to be taken to a logical conclusion. So women sadly develop UTI more by anatomy and at any age group. It could be a young girl, it could be an adolescent girl in a school and college, it could be a young lady getting married, it could be a mature woman absolutely in prime of life, busy with her lifestyle and probably would miss out on aspects of urinary health. And finally, all postmenopausal women who have got no hormones in that area and probably the immunosuppression to local areas are worsened by diabetes, by obstruction to the urinary flow, urine not emptying completely, and all age-related changes where you get nocturia and bedwetting. So women sadly go through it, and I hope that this channel works on this aspect of creating an awareness where more and more women who getting recurrent urinary tract infection actually get recovered. When we look at them, work them up, look at their proper midstream clean catch urinary specimens for routine and culture, and just not the first specimen that they gave from a contaminated introitus. We look at the uroflowmetry and understand that the flow is lesser than what could actually should be at this age, and looking at the emptying mechanism and studying and identifying them. Many of these women also have interstitial cystitis, bladder pain syndrome, and need to identify them and sort them out. So, aspects of care on urinary health in women, which so commonly could develop urinary infection with burning, discomfort, pain, is treatable and curable. It needs to probably be seen by us. Let's just switch over quickly and look into male urinary tract infection, male UTI. If you've not heard that, then please don't miss out that men also develop UTI. And the four common causes that I continue to see in the last 25 years non-stop, where men develop urinary infection and somebody has just done a urine routine culture, treated them with antibiotics and left them alone, and probably has missed out that important cause of why UTI. why men develop UTI, and how do we prevent them from urinary tract infection. So there are four causes only, which I mentioned, could develop a urinary tract infection in men. Number one, it could be an uncircumcised situation where the prepuce of the skin can be too tight. We probably, as non-circumcised individuals, don't maintain a hygiene by pulling the skin back regularly, washing it up with soap and water. We apply soap everywhere in the body, but don't apply soap and water and maintain that hygiene expected of an area which is so contaminated inside the prepuce. That means the preputial sac or the tip of the penis. It's just missed out and nobody talks about it. And what we do is when we give a urine sample through that sac, which is already contaminated with debris and all preputial contents, it actually would show pus cells, bacteria, and probably some of them actually could walk into the urinary passage called the urethra and give you a burning sensation, discomfort, more so in poor hygiene, more so in occlusive phimosis or a tight phimosis. So the first cause of non-circumcised men developing urinary tract infection is just because they have a phimosis. They have a tight skin, the skin which has not been pulled back. In the younger age group, the skin is too tight. The skin probably does not retract back during erect shaft of penis, not even in the non-erect conditions. And these are causes of UTI in many men. Somebody has not looked under the undergarments because he has not seen a urologist. And therefore, it behoves that we examine all men who come around, who may complain or not complain, but we pick up something that they've adjusted to so well. So phimosis or skin being tight and not being pulled back and maintain hygiene is the commonest cause of urinary tract infection in men I get to see nonstop at all age groups. The age groups could be anything. It could be of the age group of 10, 15. It could be 25, 30. It could be 70, 80, even 90. So you need to understand that this is a common phenomenon. Number two, men develop urinary tract infection because there's a blockage in the urinary passage called a stricture urethra, or the urinary passage is narrow. They pass through a narrow passage, they adjusted to it very well through something which has happened in the past. It could be either a trauma or instrumentation or an injury or something which narrowed the urethra, and there was a blockage in the urinary pipe called stricture urethra. Normally, we treat stricture urethra and cure it by a urethroplasty to come out of the situation. That means men complain of poor and obstructive flow. But imagine if somebody is getting recurrent UTI, ask him a simple question, is your flow very good? He may complain of burning sensation along the urethra, and we may continue to giving him antibiotics based on urine culture, and that may not help him completely. So identification is completely based on the history and clinical examination, and we pick up that. So somebody can have a past history of urinary issues, urethral issues, and we missed it out completely. Let's go to the next individual who could be in his 40s, 50s, 60s, or even 80s and 90s. He could be having a prostate that is occluding the urinary passage and tightening the urethra. That means there's a bladder outflow obstruction because of a prostatic enlargement or occlusion of the prostate, and therefore not letting the urinary passage open. These men in their 40s to 80s have poor flow of urine. They have got obstructive component. Obviously, they're adjusting it every day of their life, every year, every decade, and it's progressive. Nothing stays static, nothing is like a statue. So got to be very careful that patients with bladder outflow obstruction, that means men in their 40s to 80s who don't empty their bladder completely, who have an obstruction to the flow, who have got a prostatic enlargement and have never been evaluated by a urologist, never been seen what is their flow pattern, could actually be having an obstructive flow pattern that we study on a uroflowmetry. These kind of men, because of their enlarged prostates, are being treated for enlarged prostate, which is only an enlargement related to hormones. We have not looked into their obstruction to the flow of urine, which is an important aspect. And they would not complain many a times. They would sometimes complain very significantly. Their complaint has to be looked into. It has to be quantified and evaluated. And that's where we do a test called uroflowmetry across my room in the privacy of a toilet. When you pass urine in full flow, you may not have a great flow. Your flow may be lower than a bell-shaped curve with a staccato, an intermittent, or a baseline pattern, and a high residual volume on a live flow pattern. That's one. And finally, men could develop urinary tract infection because of the fourth reason, and that reason is a hypocontractile bladder or a weak bladder. A bladder has to contract to push urine out. And imagine if the bladder does not push urine out and the urine stays back into the bladder, then probably you could get infected. More so in diabetic individuals. So those who are more than diabetics of 10 to 15 years, those who don't have a good urinary flow, it is not always that they have got a prostate which is occluding. Many a times they have a hypocontractile bladder. The very pacemaker, the bladder, doesn't initiate the contraction to push urine out. So the sensations are lower. They probably don't empty urine so well.